What does trauma informed care mean to you in the context of working with unaccompanied children? Like, for example, what are some of the essential principles that's used when working with them for you?
Yeah, so trauma informed care, what it means, right, is meeting the clients where they're at, taking a lot of their culture into consideration, knowing, being familiar, right, because we don't ever truly know. But being familiar, asking them, right? I'm a big believer of regardless if you're 3, 5, 10, 80, asking for permission, for consent, um, to so that they hear, like they know that they're being heard and seen.
When an unaccompanied child first comes to your service, what trauma informed screenings or intake process do you use to ensure their safety and trust? Like, are there any specific standard tools that are used when assessing?
Yeah, so we use a system called Blueprint assessments. So obviously we first start off with the intake, right? And it's like a biopsychosocial that we complete, just to gather all the information, as much as information as we can get. I can say most of our clinicians are trained to say, we're going to ask a lot of questions. But again, it's going back to that trauma informed care of only share what you feel comfortable sharing, because we know that that rapport and that trust is going to take time. With the older teens, right? It's like, hey, how are you? What's your favorite color? And tell me your deepest, darkest traumas. So that's why we always tell them just share what you're able to. So it starts off with a biopsychosocial assessment, right? So that's like the informal assessment. At that moment, as you're completing the intake, you're seeing what their body language is telling you. You're able to read the room, read the attunement with the client. Are they comfortable? Are they not? You're able to look at their facial expressions, right? So in that part, that's the informal assessments that we're doing with the clients. But then we also have standardized assessments, right? Like the GAD, the PHQ-9, um, the SCARED. That's the one that measures anxiety in children. We do the ACEs, we do CATs. So a lot of it is to measure the symptoms of anxiety, depression, and of course, trauma.
What therapeutic modalities or interventions, like, for example, play therapy or narrative exposure therapy, EMDR, have you found most effective when working with unaccompanied children with trauma histories?
Yeah, so I would say with children, um, so I'm working towards my RPT, my registered play therapy. So I'm a big believer of play, right? Because play is a children's first language. So for sure, play. I'm also trained in sand tray therapy. So we do sand tray, play, and then of course EMDR. So I would say the combination. I'm a big believer of, if I have to borrow a little bit from each modality to fit to the client versus making the client fit to the modality, if that makes sense,
Yes, so it's more like personalizing it for them.
and integrating it a little bit of each. Yeah.
Accompanied children often interface with like multiple systems, for example, like immigration, schooling, foster care, like legal system. So how do you coordinate trauma informed care across these systems to reduce the re-traumatizations, for example, like when they have to retell the stories to every individual they meet?
Yeah. So I think we use the beauty of therapy, right? Is that they don't necessarily have to repeat it in words. So we are able to use play, right? It could be that, for example, a combination of Sandtray and EMDR, um, versus saying, starting off even in the beginning, like, tell me about yourself. Like when anybody asks that question of tell me about yourself, you kind of freeze up and you're like, I don't know what to tell you about myself. So something we do is we have them draw a heart and what fills your heart, right? And then they're able to fill in whether and there's no wrong answer. Like it'll go wherever they need to go. If you're doing EMDR and sand tray, right? Create a tray about yourself. What are your likes? And so you're able to add that in.
What trainings or supervision support do you provide or like expect for clinicians at Canada to maintain a trauma informed practice, especially given the complexity of like working with unaccompanied children?
Yeah, so I really encourage, so I oversee interns and I oversee supervisees that are working towards their C. But not just them, even the clinicians that are under us. We are constantly looking for trainings, right, so that they stay aware. I can tell you, like in my supervisions, I am constantly trying to stay up to date with the different laws that are changing, because obviously, as social workers, tied into the code of ethics, but not just that, we need to be aware of how that's impacting our clients, right? Because right, due to the political climate and everything that's going on, we can tell our clients breathe, but like that's not really going to do anything. A lot of the times it's just being present with them. So I myself as a supervisor try to stay informed as much as I possibly can with the different laws that are changing, because I know that then clinicians and supervisees and interns are going to be coming to me of like, hey, you know, XYZ, and how's that impacting our clients? So that's a big thing. Any trauma informed, like I said, any trainings that are like popping up, we try to share out. And I encourage my interns and my supervisees to read Decolonizing Therapy. Again, so practicing from that trauma informed lens. And we actually have like several different books that we encourage them to read so that they can be better prepared when they are working with clients.